Hello, my name is Maram Al-Haj Ahmad. Welcome to the first episode in FIP's CPD Bite series, which are titled From Prescription to Over-the-Counter, Pharmacists Ensuring Safe and Effective Pain Management. In this episode, we will focus on the key considerations in managing switches to OTC analgesics. By the end of this session, you will understand key considerations pharmacists must address during patients' transition between prescription to over-the-counter analgesics for pain management. You will learn about dosage differences' impact on patients' safety and effectiveness in pain management. You will identify misconceptions about OTC painkillers often faced by pharmacists. And finally, you will develop improved counseling techniques for guiding patients from prescription to OTC medications. As we all know, the shift of medications from prescription-only medications, POM, to over-the-counter OTC status is becoming increasingly significant. This trend is driven by patients' enhanced capability to self-diagnose and manage their health conditions. As pharmacists, understanding these transitions is essential to effectively support patients in their self-management and ensure the safe use of OTC medications. Different countries have seen an increase in the consumption of OTC medicines. Studies show that analgesics, which are pain medications, are the most consumed, followed by antitussives and medicine for common cold. Supporting patients' decision-making and as they transition from prescription-only medication to OTC requires pharmacists' critical assessment of the following. Let's start with safety. We have to ensure that the OTC analgesics will not cause major adverse effects or interact with other medications that the patient may be taking already. Efficacy. We have to assess whether the OTC analgesics have been proven to address the patient's condition compared to other alternatives. Proper labeling. We need to make sure that the OTC is clearly labeled and direct the patient to always refer to instructions and warnings. Cost is an important factor. We have to consider if the price of the OTC analgesics are affordable for the patients while still providing therapeutic value. Individual level factors have to be taken into consideration too. Example, age, patient medical history, medication, personal beliefs, attitudes, knowledge about OTC's assessment of the alignment and medical constraints. Kindly make sure to watch the second episode where we will further explore these considerations using a role play. Regulatory frameworks play an important role in the transition of medications from prescription-only medications to over-the-counter status. Key regulatory bodies involved in the process include the European Medicines Agency, EMA, the BfArM in Germany, the US Food and Drug Administration in the United States, and the Medicines and Healthcare Products Regulatory Agency, MHRA, in the United Kingdom. These bodies have stringent requirements for safety, efficacy, and proper labeling that must be met for a medication to transition to OTC status. Each regulatory framework may have specific requirements and processes, but these general criteria are commonly considered during the prescription-only medication to OTC switch evaluation. Real-world data and real-world evidence are increasingly important in the decision-making process for these transitions. For example, the FDA requires evidence that the medication can be used safely and effectively by consumers without the supervision of a healthcare provider. This approach ensures that OTC medications are both safe and effective for public use. The data required by regulators to support a switch from prescription-only medication to OTC includes efficacy and safety data from randomized controlled clinical trials, as well as post-marketing safety surveillance data. A wide range of different data sources, many of which can be regarded as real-world data or real-world evidence, are used to support these switches. Having clear and transparent regulatory frameworks increases the number of OTC medications available and ensures that these medications are safe and effective for our patients. Here you can see a summary of the criteria considered by regulators to approve OTC medications. For more information, please consult the references listed at the end of this episode. One critical aspect of transitioning a medication from prescription-only medication to over-the-counter status is the difference in dosages. This transition can significantly impact both the safety and efficacy of the analgesics. Most OTC analgesics fall into one of two categories: non-steroidal anti-inflammatories and acetaminophen. And there are different subtypes, different brands, and generic options, of course, within each of these categories. OTC dosages are typically lower to minimize the risk of adverse effects when used without medical supervision. This reduction in dosage while enhancing safety can potentially lead to less effective pain management. Most risks associated with non-steroidal anti-inflammatories are related to the pharmacological properties, dose, and duration of use. Usage patterns differ significantly between prescription-only medications and OTC non-steroidal anti-inflammatory, influencing potential risks. Moreover, interactions involving OTC drugs can produce undesirable outcomes to make other medications less effective, particularly when combined with prescription medications. As pharmacists, understanding and effectively communicating those differences to our patients is very important. Consider a case where a 45-year-old patient previously managing chronic knee pain with prescription of ibuprofen 600 milligrams every 8 hours switches to an OTC dose of 200 milligram every 4 to 6 hours. The patient reports less effective pain relief and experiences minor gastrointestinal discomfort. This case highlights the importance of pharmacists explaining the rationale behind lower OTC dosages and advising on proper usage to manage expectations and ensure safety. As pharmacists, we often encounter several common misconceptions about OTC analgesics. It's crucial to address these misconceptions to ensure patient safety and effective pain management. Firstly, there's a widespread belief that OTC analgesics are completely safe. While these medications are safe when used correctly, they can still cause harm if misused. For example, taking more than the recommended dose of acetaminophen can lead to severe liver damage. It's important to educate patients that even OTC analgesics have risks and should be used responsibly. Secondly, many patients believe that taking higher doses will provide better pain relief. This is not true and can be dangerous. Higher doses can increase the risk of side effects and toxicity. For instance, exceeding the recommended dose of ibuprofen can lead to gastrointestinal bleeding and kidney damage. Another misconception is that combining multiple OTC medication is harmless. Patients often don't realize that many OTC products contain the same active ingredient. For example, combining different cold and flu medications can lead to an accidental overdose of acetaminophen. It's essential to advise patients to read labels carefully and consult with a pharmacist before taking multiple medications. Lastly, the idea of one pill will make the patient feel better is unaccepted because masking symptoms with OTC meds can delay seeking professional medical attention. This can lead to a worsening of the underlying condition and potentially more complex treatment later. Effective counseling is an important aspect of pharmacists' role, particularly when guiding patients through the transition from prescription to OTC analgesics. By improving our counseling techniques, we can enhance patient understanding, adherence, and overall health outcomes. Firstly, employing techniques for effective communication is fundamental. This includes active listening, asking open-ended questions, and using simple, clear language to explain medication usage and potential side effects. Active listening involves fully focusing on the patient, understanding their concerns, and responding thoughtfully. Secondly, personalized counseling approaches are vital. Every patient is unique with different health background, different conditions, and needs. Tailoring our advice to each patient's specific situation can make our counseling more relevant and impactful. For example, advising a patient with a history of gastrointestinal issues on the safe use of non-steroidal anti-inflammatories. Utilizing visual aids and patient education material can significantly improve understanding. Tools like brochures, charts, diagrams can help patients grasp complex information more easily. For instance, using a chart to explain the differences in dosages between prescription and OTC analgesics can clarify why lower dosages are necessary for OTC products. Lastly, engaging in role-playing and scenario-based training can enhance our counseling skills. These methods allow us to practice and refine our techniques in a controlled environment, preparing us for real-life patient interactions. Scenario-based training can include common situations, such as advising a patient on managing pain with OTC analgesics or addressing misconceptions about drug safety. By adopting these strategies, we can improve our counseling techniques and better support our patients in managing their pain safely and effectively. Pharmacists play a critical role in pain management transitions. Understanding the criteria behind prescription to over-the-counter shifts equips pharmacists with the knowledge needed to support patients effectively. Distinctive dosing variations between prescription and OTC formulations demand vigilant management to safeguard patient well-being and treatment effectiveness. Pharmacists, given their specialized knowledge of medications, are ideally positioned to offer tailored education to patients. Through personalized dosage adjustments, pharmacists optimize therapeutic benefits while mitigating potential risks, ensuring patients receive the most effective pain management regime for their unique needs. Pharmacists should proactively engage patients in discussions to dispel myths and provide accurate information based on evidence and guidelines. Also, pharmacists can empower patients to make informed decisions about pain management. Open dialogue, personalized education, and ongoing support are key components of effective patients counseling in the transition from prescription to OTC analgesics.